dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I am Yvonne Dunetz, and my guest today is Melissa Grenier. Melissa is the Regional Manager for the state of New Hampshire for the Alzheimer Association. Her role includes providing the Alzheimer Association's wide range of programs and services to those diagnosed with memory impairment, their loved ones, caregivers, and the public. Today, we will be discussing the programs and services for those diagnosed with memory impairment, their loved ones and caregivers, and the public, and how you can access them. Welcome, Melissa. I'm delighted that you're with us today. And it'd be very interesting for our community that watches us to let them know what are the statistics out there nationwide, as well as in New Hampshire, related to how many people are, in fact, impacted by being diagnosed with Alzheimer's disease.
Great. Well, first of all, thank you for having me.
I'm delighted you're here.
And so when we're talking about statistics nationwide, we have over 5 million people in the United States living with Alzheimer's disease.
Has that increased over the years?
It has. Baby boomers are now aging and turning 65 at a rate of 10,000 people per day. So there is a wave of baby boomers that is aging right as we speak, and that is only going to increase the number of people who are in that age population, but also the number of people that have Alzheimer's disease as well.
And why is that? Is there something going on environmentally that could be increasing the fact that people are getting Alzheimer's? It's different than just regular aging, we know that. What are the indicators? Why is this happening? Why are we seeing more people with it?
So there's a lot of factors related to why more and more people are coming down with Alzheimer's disease, if you want to put it that way. First of all, with the population explosion of baby boomers turning 65 at a rate of 10,000 people per day, even if the percentage of people that develop the disease remain the same, the fact that there's more of those people would mean that there's more people developing it.
Is there any way to prevent it?
There are ways that one can potentially reduce their risk of developing Alzheimer's disease, making sure that things like, for instance, their blood sugars are kept within normal ranges, making sure they're going to the doctor so that if they do see some of those early warning signs of cognitive impairment, that they're able to get those addressed early and accurately. And that's actually a second reason why people are being diagnosed what seems like more nowadays, and that's because we have more advanced technology to be able to diagnose people earlier and more accurately than ever before.
What are the common things that are used for diagnosis of this disease?
A lot of times, folks will go see their primary care physician initially to address their concerns. The physician may do some preliminary testing to rule out some of the more common causes of memory changes that people have. So they may do some blood work or urinalysis and get a thorough history to make sure that it isn't something that's treatable, such as an infection or a thyroid condition or a vitamin or nutrient deficiency or dehydration or many other things. So once they've ruled out those more common things, they may send the person to a specialist, which might be a neurologist, or they may order further testing, like for instance an MRI can be helpful in ruling out things and potentially ruling in some forms of dementia. And there are also other specialists that they can be sent to see. A geriatrician is really, frankly, a primary care physician that specializes in people as they age. Mm-hmm. And there are also neuropsychologists, and those folks help test people with cognitive impairment in a really specific way to help understand what specific type of dementia they may have.
Okay, now you're a regional manager for the Alzheimer's Association. So what does that encompass?
So as the regional manager, my role is to provide a wide array of our programs and services. And in New Hampshire, we actually have 23,000 people living in our Granite State that have Alzheimer's disease as a diagnosis.
Now, has that increased over the years?
It has. Actually, between last year and this year, it had risen from 22,000 to 23,000.
And that is because of what? Is that because of an increase in aging of the population or for other reasons?
It could be, it's most likely because of the continued aging of the population. And New Hampshire is one of the oldest states in the country, so we have a lot of folks that maybe go down to Florida for a number of years, a couple decades, and then they say, geez, I'm getting older, I want to move back home to be closer to my family or my kids. So we have a lot of people that are aging in place in New Hampshire. So we're seeing a significant number of people who are older adults and are more and more at risk for developing Alzheimer's disease. And we're also obviously seeing people that are developing the disease. So,
Yeah. Go ahead.
so there's the point of that is just that there's so much need, even in our one small state.
And you mentioned more people at risk. How are they more at risk?
So as we age, our risk for developing Alzheimer's disease goes up. Let me give you a couple statistics about what that looks like.
Please.
So if you're over the age of 65, a person has about a 1 in 9 chance of developing Alzheimer's disease. And if they're over the age of 85, they have about a 1 in 3 chance of developing the disease. But what I like to tell people is that if you're over 65, you have an 8 in 9 chance of probably not developing the disease. And if you're over 85, then that's fantastic. And you must be doing something right. And you have a 2 out of 3 chance of not developing the disease. So I just say that so that people don't get hung up on the numbers, but it is very significant, and age is the #1 risk factor for developing Alzheimer's.
Any preventative measures that can be taken?
So those preventative measures are going to see your doctor regularly, keeping those blood sugars in check, especially because diabetes is linked with Alzheimer's disease. We want to make sure that other vital signs like person's blood pressure, their cholesterol, things of that nature, are also kept within normal ranges, because if those things are left untreated, those can lead to an increased risk of other types of dementia. For instance, vascular dementia, which is caused from a stroke or a series of mini strokes at times. And so reducing our risk starts there, but it can also start with knowing the warning signs and getting educated, really, and doing all those good things that our doctors have been telling us over the years. Eating healthy, moving, trying not to be stressed. Stress causes inflammation, and inflammation isn't good in our body. So there are some simple things that we can do already: lower our saturated fat intake, eat more fruits and vegetables, things of that nature.
Let's talk about the programs that you offer, because we want to let people know how they can help get themselves resources and support. So what do you do?
The biggest thing that I would want the community to know and be aware of is our 24/7 helpline.
And what is that?
Our 24/7 helpline is just like what it sounds like. It is 24/7. It is nights, weekends, and holidays. And what that is basically a gateway to everything else that we do at the Alzheimer's Association. It's a toll-free 1-800 number that works nationally. So people in California can use this number. People in New Hampshire can use this number.
And what is the number?
The number is 1-800-272-3900.
And we'll have that up on the screen for you also. And so anybody could call related to any questions, any concerns, any problems, any need for assistance.
Absolutely.
And call this 1-800, what is the number again, please?
1-800-272-3900.
And someone live will answer the phone and help direct them to the care that they need.
That's exactly right.
And the types of care that they may be directed to would be what?
So we offer a lot, and what's great about the Alzheimer's Association is that we do not charge for our programs and services.
Wonderful.
So people can call for something as simple as a support group list, for instance.
Okay.
Or a professional could call and say, I lost track of where there are driving evaluation centers in New Hampshire. Can you send me a list? Or I have this family who would really like to speak with somebody in more depth. Could I refer them to you to set up what we call a care consultation? A care consultation is an in-depth meeting that provides support and information to a person with memory impairment or their family. And there's no referral, there's no copay, I get to meet with them. I can meet with them for an hour or two and go over their specific concerns, which unfortunately in this day and age, medical practitioners just don't have that time to sit down with people who are being diagnosed or their families to let them know where this disease is headed for them, what their journey is going to look like.
Really? So you provide this. Who supports the Alzheimer's Association where you have the ability to provide these services for free?
That's a great question. I get asked that a lot. And really, it's through community support. We could not do what we do here in the Granite State and also across the United States without the support of our community partners. So organizations, agencies, they may sponsor some of our events. But really, the backbone of how we're able to do this is because families and community members group together. They form teams. For instance, our Walk to End Alzheimer's, which we have 3 walks every September in the state of New Hampshire. So they get together with their loved one with memory impairment or in memory of their loved one with memory impairment, or just because they see it as such a need in the community and they maybe want to just support our organization because they've heard good things or they've used us in the past.
That's wonderful. So of all the services that you provide, what do you believe for our viewing audience would be the most important for them to avail themselves of?
That's great. So I would say that our educational programming is one of the best services that we offer to the community because it's in the community where people live. So a large part of what I do is just that, is traveling across the Granite State, providing general information about the disease, doing professional trainings, but also working with families to strategize around communicating better with their loved one, managing some of those tough behaviors that are associated with the disease throughout the disease process. We offer a legal and financial program so that people can understand some of the importance of planning for the future, but also some of the legal trip-ups they may have, if they have the disease or if they are caring for someone with the disease.
Like what might that be, for an example?
Well, so for instance, guardianship. A lot of people, don't understand guardianship or when advanced medical directives can sometimes negate the need for guardianship. Planning for the future really will help guide that person's care once they're not able to make their own decisions anymore. When those plans are not put in place, guardianship sometimes becomes necessary, and guardianship is a costly, time-consuming process that a lot of people don't want to have to deal with. So that's why we want to encourage people when they have a diagnosis or when their loved one or family member has the disease, that they plan ahead so that they don't have to worry about some of these stressful topics later on in the disease process when the disease and the care that that person needs really should be at the forefront.
Okay. What other support programs do you offer that you want our communities to know about?
Great. So we offer a lot of support groups. I work for the Massachusetts New Hampshire chapter of the Alzheimer's Association. So our support groups, we have over 100, and they, are all over Massachusetts and New Hampshire.
How can someone connect to that? Do they call again your hotline, or where do they call to join one?
Absolutely. Definitely our 1-800 number.
Okay.
And viewers will see that on the on the
We
screen.
can say it again, 1-800.
So it's 1-800-272-3900.
And that would be a way to get any type of help as well as to find out where the nearest support group is. What else?
There's another resource that is associated with our direct website. It's a new part of our website called Community Resource Finder. And the website for that is very simple. It's communityresourcefinder.org.
Okay.
And people can go there and find out literally anything that they need to know. If they, for some reason, couldn't reach us and they left a message, and we're going to follow up with them, or intermittently, if we're meeting with a family and they don't want to have to come in for a care consultation, they can help themselves to all kinds of community information. So our support groups are listed there. Our educational programs are listed there. Lists of certified elder law attorneys, home care agencies, hospice, really anything that is associated with a person with memory impairment is going to be listed on that website.
Do insurances cover Alzheimer's disease, or is this a problem for people?
The cost is incredible with this disease. It is now the most expensive disease in the United States.
And why is that?
Well, because in my mind, it really takes a village to sort of take care of someone with this disease. And there's costs associated, a lot of medical costs, but a lot of what the medical community would call custodial care needs. And what custodial care is, that has to do with all of those day-to-day tasks that a person with memory impairment needs help with, but that is not covered by their insurance. So if I have Blue Cross and Blue Shield, I'll just throw that out there, that is not going to cover having an aide come in and help me shower twice a week.
Now, if you had long-term care insurance, would that cover that?
Yes, it can, depending on the policy, and they vary quite a bit, but long-term care can help provide, long-term care insurance, can help provide care in the home, so through a home care agency, and a lot of times it can also cover care that a person might need when they advance a little bit into the disease process, and they may need assisted living levels of care or even skilled nursing levels of care. But it's very frustrating when people call and they say, well, what types of things can I expect my private insurance to cover? And I have to say, they won't cover what you're referring to maybe. They will cover if someone goes into the hospital and needs VNA services when they get home for 8 weeks, because those are deemed medically necessary and they're skilled medical needs. So if someone needs to check an incision or vital signs or those sorts of things, that requires a nurse or an aide or physical therapy. Those things are covered usually by people's insurance. But helping with meal prep, reminding people about their medications, helping with ongoing personal care and grooming, those sorts of things are not covered.
Are those resources out there for people?
There are some resources that are out there. One of the biggest underutilized resources out there is the Veterans Administration.
Tell us about that.
So I ask every family that comes in or that calls, I ask them if they have served in the military or if their spouse has served in the military. There's a program, a federal VA program called Aid and Attendance. It's for people who need aid and attending to, and it's incredibly underutilized, and it requires that a person need ongoing care, and Alzheimer's disease falls into that chronic disease category. And so many times a qualified veteran if they qualify for this program, would be able to get a monthly stipend to cover the cost of these extra care needs, having a home care worker come in, adult day health programs, things of that nature. That extra money can help keep people in the community for a long time. And the other thing that people forget about is that that program can also cover a spouse of a qualified veteran who has Alzheimer's. So when I have wives that come in and their spouses have passed on, but their spouses were veterans, I tell them to go ahead and check with the VA. The worst they're going to say is no. But a lot of times people will find out that, geez, I can qualify for a slightly lower amount, but that they can still qualify for aid and attendance and get those extra funds that could, again, help sustain them in the community for longer.
So through your association, you provide guided help, but you do not have specific caregiving resources that you provide through the Alzheimer's Association.
That's correct.
So do you vet a variety of different organizations and businesses that provide these types of services so that you can recommend them with confidence that these particular agencies, groups, businesses, or whatever can serve this population in an excellent way?
So we don't have a system for direct referrals. We're not affiliated with any particular agency, hospital, organization, because frankly the problem is so widespread. It doesn't it doesn't affect just one area or agency. And so what we do is we do not provide any direct care. So that is important for people to understand. But we will help people find the resources in the community that they need. And if I can't, then I will sure try and find other ways that they can plug into resources that maybe they hadn't thought of before.
Let's list some of those community resources that people might need. What might they be?
So a couple minutes ago, I mentioned adult day health programs. Adult day health programs, in my mind, are a very economical way for caregivers to get some rest. So it could be 6 or 7 hours that their loved one goes to an adult day health program. There's supervision and appropriate activities for that person's level of cognition. And during that time, the caregiver can rest, they can go do whatever they need to do, go to their own doctor's appointments. And again, it is very cost effective. People will pay a lot less to have their loved one all day at an adult day health center versus having a private caregiver come into the home. So that's incredibly useful. And the some other programs just in our area here are Easter Seals.
Okay.
So Easter Seals has a main office in Manchester, New Hampshire. They have a variety of different day programs depending on what level of cognition a person might be at. So they may come in and they're more independent and they're higher functioning, and as the disease progresses, which it will, unfortunately, then they have a day program that could be appropriate for them and another one after that. So these are not just programs for people that are more independent. As they move through the disease process, they have other things to offer them.
Okay, and what other resources?
So senior centers right in people's hometowns, I usually recommend that they reach out to their local senior centers because I can only keep track of so much, and a lot of times senior centers are aware of or provide special programs that maybe I wasn't even aware of. Like for instance, the senior center in Exeter has a program associated with a local cab company to provide discounted fares for people in Exeter or the area that need to go to their doctor's appointments and no longer are driving, which is a big issue for people with memory impairment.
Of course. What are other big issues for memory impaired people?
I would say wandering is a big issue. Just the need for folks with memory impairment to have appropriate supervision, because at some point in the disease process, they will need 24-hour supervision. It doesn't mean that they need hand-holding.
Right.
It just means that someone needs to be nearby in case they wander, in case they start maybe rummaging into things that aren't safe or appropriate for them, or so that there's someone nearby if they are taking a shower independently still, just in case, just to make sure that they're taking their medications, that they're eating, that they have some socialization and they're not just sitting there alone.
Which is the worst thing that can happen.
Right. Absolutely.
All right then. So you provide this wonderful service of help to people that are diagnosed with memory impairment as well as to their family members. So for family members, there are supports for them. They can call the hotline at any time.
Absolutely.
Are there particular supports that are geared for the family member?
Some of our education programming is specific to family members or care partners specifically. Right. Other programs that we have are appropriate for people with early stage Alzheimer's.
Okay.
So when people go on our website, they will find descriptions of all of our programs, as well as a notation of how long those programs are, because we want people to know how much time they need to take away from their loved one. And those descriptions will help differentiate between whether this is appropriate for me as a person with Alzheimer's or me as a caregiver. So our education programming, but also support groups. And frankly, our care consultations are an incredible support to families that need to be able to vent some of their frustrations or ask for services that aren't comfortable for them to talk about in front of their loved one.
Yes.
So we've got a lot of resources for family members and just the community at large.
Now the care consultations, how might someone make an appointment to have that done? And that's a free service.
That is a free service.
So how would they connect to do that?
They could call our toll-free helpline at 1-800-272-3900. But if they visit our website, which is www.alz.org/MANH, because we're the Massachusetts New Hampshire chapter, they can actually request a care consultation through our website as well.
They can.
Yes.
That's wonderful. That's wonderful. Are they able to also connect with other resources on the website?
Absolutely. Our website has so much information. Someone could probably spend a year just investigating the disease, resources, ways to get involved with us, really updates to research, updates to our legislative efforts in the Granite State, but also nationwide. So there's so much on our website. I really encourage people to utilize that. But there are plenty of people that we serve in the community that do not have access to the internet.
Right.
And
So how else?
So that's how the telephone number is really how I would request that they call in, because anything that we provide on our website is something that we most likely would be able to send them in the mail.
Oh, that's wonderful. And that, again, can be sent to them without charge.
Absolutely.
So that hotline number for any resources, any help, individual consultations, support for the individual that's diagnosed with Alzheimer's, or for family members or caretakers is?
1-800-272-3900.
And the website, again, is?
Our local website is alz.org/MANH.
And the other thing that you said is that the work that you do is really supported by communities, businesses, and organizations. So how might people get involved with or learn about the ways that they can support you to do the excellent work that you do? Would it be through your website?
Well, people can find out about our upcoming events
Okay.
through our website.
Okay.
But a couple to be aware of are our annual walks to end Alzheimer's.
Okay.
We have them in Keene, Manchester, and Portsmouth.
And they're coming up in June?
Those are in September.
September. Okay.
Yep, those are in September.
Okay.
And another interesting event is called the Longest Day, and that is on the summer solstice, and that honors people who are caregiving from sunup to sundown, and we have a fundraising event associated with that.
That's wonderful. So people can learn about that, again, online
Yes.
at your website, which is?
www.alz.org/MANH.
Excellent. And the hotline number is?
1-800-272-3900.
So the important thing for everyone to remember is that you do not have to be alone within this disease when you're diagnosed, nor does your family. To go, reach out to the Alzheimer's Association, an excellent organization there to help you every step of the way and to assist you in getting the resources and the supports that you need so that you can live a full life and be able to have all of the supports that you need for yourself, your loved ones, and to truly have a really coordinated community caregiving opportunity.
Yes.
I thank you so much for everything that you do.
Thank you.
And again, that number is, we'll end with that,
1-800-272-3900.
Until next time, thank you very much and have a great day.
The preceding program